A client is diagnosed with renal failure. The nurse must monitor for failure of which functions. Select all that apply. A client is diagnosed with renal failure. The nurse must monitor for failure of which functions. Select all that apply. Functions of the kidney include removal of metabolic end products and regulation of body water, electrolyte balance, and acid-base balance. Although the adrenal glands are located above the kidneys are not directly involved in their regulation. A client with a history of chronic renal failure receives hemodialysis treatments 3 times per week through an arteriovenous (AV) fistula in the left arm. Which intervention should the nurse include in the care plan? A client with a history of chronic renal failure receives hemodialysis treatments 3 times per week through an arteriovenous (AV) fistula in the left arm. Which intervention should the nurse include in the care plan? The nurse needs to assess the AV fistula for a bruit and thrill, because if these findings aren't present, the fistula isn't functioning. The AV fistula may get wet when the client isn't being dialysed. Immediately after a dialysis treatment, the access site should be covered with adhesive bandages, not gauze. Blood pressure readings or venipunctures shouldn't be taken in the arm with the AV fistula. Dialysed. A client with a recent diagnosis of renal failure requiring hemodialysis is being educated in the dietary management of the disease. Which statement by the client shows an accurate understanding of this component of treatment? Select all that apply. A. I've made a list of high-phosphate foods so that I can try to avoid them. B. I don't think I've been drinking enough, so I want to include 8 to 10 glasses of water each day. C. I'm going to try a high-protein, low-carbohydrate diet. D. I'm making a point of trying to eat lots of bananas and other food rich in potassium.
E.
I'll increase the carbohydrates in my diet to provide sufficient energy. Persons with chronic kidney disease, CKD, are usually encouraged to limit their dietary phosphorus as a means of preventing secondary hyperparathyroidism, renal osteodystrophy, and hypocalcemia. Excessive protein, potassium, and fluids can be detrimental in individuals whose kidney disease requires hemodialysis. Because protein intake is limited, carbohydrate consumption should increase to meet daily energy requirements. A client with chronic renal failure, CRF, is receiving a hemodialysis treatment. After hemodialysis, the nurse knows that the client is most likely to experience Because CRF causes loss of renal function, the client with this disorder retains fluid. Hemodialysis removes this fluid, causing weight loss. Hematuria is unlikely to follow hemodialysis because the client with CRF usually forms little or no urine. Hemodialysis doesn't increase urine output because it doesn't correct the loss of kidney function, which severely decreases urine production in this disorder. By removing fluids, hemodialysis decreases rather than increases the blood pressure. Okay. A client develops acute renal failure, ARF, after receiving IV therapy with a nephrotoxic antibiotic. Because the client's 24-hour urine output totals 240 milliliters, the nurse suspects that the client is at risk for A client develops acute renal failure, ARF, after receiving IV therapy with a nephrotoxic antibiotic. Because the client's 24-hour urine output totals 240 milliliters, the nurse suspects that the client is at risk for paresthesia, B. Dehydration, C. Pruritus. As urine output decreases, the serum potassium level rises. If it rises sufficiently, hyperkalemia may occur, possibly triggering a cardiac arrhythmia. Hyperkalemia doesn't cause paresthesia, sensations of numbness and tingling. Dehydration doesn't occur during this oligoric phase of ARF, although typically it does arise during the diuretic phase. In the client with ARF, pruritus results from increased phosphates and isn't associated with hyperkalemia. As urine output decreases, the serum potassium level rises. If it rises sufficiently, hyperkalemia may occur, possibly triggering a cardiac arrhythmia. Hyperkalemia doesn't cause paresthesia, sensations of numbness and tingling. Dehydration doesn't occur during this oligoric phase of ARF, although typically it does arise during the diuretic phase. In the client with ARF, pruritus results from increased phosphates and isn't associated with hyperkalemia. After teaching a client with a peritoneal catheter about the signs and symptoms of peritonitis, the nurse determines that the client has understood a teaching when she identifies which finding as an important sign. Peritonitis. Normally, dialysate drainage return should be clear. With peritonitis, large numbers of bacteria, white blood cells, and fibrin cause the dialysate to appear cloudy. Abdominal distension is unrelated to peritonitis. However, it might suggest an obstruction. Weight gain and shortness of breath are associated with fluid excess, not infection. A client with chronic renal failure complains of generalized bone pain and tenderness, which assessment finding would alert the nurse to an increased potential for the development of spontaneous bone fractures. Osteodystrophy is a condition in which the bone becomes demineralized due to hypocalcemia and hyperphosphatemia. In an effort to raise blood calcium levels, the parathyroid glands secrete more parathormone. Elevated creatinine, urea, nitrogen, and potassium levels are expected in chronic renal failure and do not contribute to bone fractures. A primary healthcare provider prescribes regular insulin 10 units intravenously, IV, along with 50 milliliters of dextrose 50% for a client with acute renal failure. What electrolyte imbalance is this client most likely experiencing? Albuterol. Administering regular insulin IV concomitantly with 50 milliliters of dextrose 50% helps shift potassium from the extracellular fluid into the cell, which normalizes serum potassium levels in the client with hyperkalemia. This combination does not help reverse the effects of hypercalcemia, hypernatremia, or hypermagnesemia. The nurse is caring for a client with chronic kidney disease, CKD. When determining the client's fluid intake for the day, the nurse takes into consideration the last 24-hour urine output and allows an additional It is a common practice to allow 500 to 800 milliliters per day, which is equal to insensible water loss plus a quantity equal to the 24-hour urine output. Fluid intake in excess of what the kidneys can excrete causes circulatory overload, edema, and water intoxication. Inadequate intake, on the other hand, causes volume depletion and hypotension and can cause further decreases in the already compromised glomerular filtration rate. The nurse is caring for a client with acute renal failure. Rank in chronological order the phases of acute renal failure. All options must be used. Chronological. Initial insult B. Oliguric phase C. Diuretic phase D. Recovery phase. Clients with acute renal failure pass through the phases in the following order: initial insult, oliguric phase, diuretic phase, and recovery phase. A small percentage of clients will not progress beyond the oliguric phase and will progress to end-stage renal disease.